Hello, my beautiful people. Is your girl again gifted gift? Yes, so this one is the interview of Obaseki on Edo State health insurance scheme. Seriously, Obaseki, you finish work for this thing because this one now abroad in Edo State. The system when this Edo State health insurance scheme they use now the same system when they use for Obodo Ibo. Yes, the Obodo Ibo when be say we Edo people would always like to run. So this is the same system whether you sick or you not sick. When you are living in overseas in the country that I live, Austria, you must pay your health insurance. Yes, good Edo people, this one a good thing when Obaseki bring come Edo State. Make una try, make una go subscribe to run a very good thing. And what I see for net, you know, they're expensive at all. Every year you feel they pay 12,000. So to pay 12,000 for health insurance na better thing because there are a lot of benefits when you go benefits for this health insurance scheme. There is the one that you can also pay 18,000. There is the one of 35,000 depending on how your power reach or you feel they pay every month. Na better thing na Obaseki do for you. And when I see Stella Obasanjo Hospital, na better thing I do for there. If we see truth, make we dey talk. Where Obaseki for pass, it good. Make it be say we good people of Edo State. We go give them a pass mark for there. Where enough for try at all, we'll just to talk and say enough try at all. Yes, for health and education, they always they give them to Obaseki. He finish work, whether opposition like him or not. Obaseki over try. Please, opposition party, I beg with the beg una incoming governor. Do not destroy any legacy, good legacy, especially that health and education when Obaseki do. Make una build on her, make una continue on her. Now so Edo State go take move forward. Yes, my name remain gifted gift. If today happen to be your first time of coming across my video on YouTube, please do me a favor by subscribing.
The last area where I feel we will go now the health insurance scheme. Because many people know, many don't know. Many are benefiting from it seriously. Many still sound like one big thing. Health insurance, I go just they pay money when I'm not sick. But I know, I wish one of my friends can even send me a voice note. Matthew Igbini Jesu. He said, Albert, they talk about this health insurance because before I subscribe, they use almost 50,000, 60,000 they treat malaria. But since you subscribe, sometimes 600 naira, 800 naira, 1.5. Children like the thing they shock and say, is this happening in Edo? You say, may we never go there. The one I want to ask you now is the trendy one, the biggest, the Oga Pata of them all, which is the Stella Obasanjo Hospital. You see, during the election, when you bring your candidate come, because first thing we make us get interest for somebody like for Dr. Asolime Iguda is that if Governor Obaseki raise person hand go up, that person head was correct. He no get how. Say person can say, Governor say I want to hand over to this person. So we know say the man when you do one hand over give. Now person wait for even perform past you. This Stella Obasanjo when we they play politics since they said you demolished the old hospital, you turn out to first they said you want to build motor park. Everything they talk, as they break, they go by themselves, still counter what they talk yesterday. Later they say no, you want to do your private business. So they say you want to put later what's say now arts and this thing. So I went to this facility when you started working there. And what I saw, I came online to say, with what Governor Obaseki is building at Stella Obasanjo, the 5-star when they make us go be like one department by the time the governor is done. Just to say you have done very well there. We saw the commissioning, then Patient Jonathan was there, the former president was there. You know, how did people want to afford this kind of facility? Obasanjo, with what you put for there, how they want to afford them?
If you not get insurance, you're not going to afford them.
Oh,
because to pay out of pocket, you're going to pay more than person when you get insurance.
Wow.
Have you seen the equipment we have there?
Yesterday I saw some of them. Massive.
to just do testing and samples alone can feed the whole of the South. Then, if you look at, take for instance, the dialysis section, we have 12 stations for dialysis.
Wow. 12.
12.
Some federal hospitals don't have 2.
No. I know it's 270 beds. Maximum you have is 3 beds in a room.
3 beds in a room.
Yes, just like in any hospital you'll see abroad. That's modern. So
Nima, so I need to go back there because
the investment we made, the hospital is not cheap. Hospital is not cheap. Let me tell you that. However, it is affordable if you get health insurance. And the hospital is not a walk-in hospital. It's a referral hospital. You're supposed to don't go somewhere and they get problem when they're not fit treat before you then bring you come there.
Wow.
Don't be saying you get malaria, you say, okay, go to the person. No, nobody will touch you. You go to your GP first, we'll check. This parasite one we see for you, we'll maybe send your sample, they will test them and say, this thing will not be ordinary mosquito malaria, maybe it's those kind, and then they'll just quickly treat you. So it's important that we don't clog the hospital, just bring in all sorts of cases. It's supposed to be a specialist hospital where we address certain peculiar diseases or certain categories of people.
Wow. So if you don't have health insurance as an adult person, you might not be able to afford it.
No, because in the first place, it's a referral hospital. They have to refer you from a primary healthcare center or another clinic. Because healthcare is not cheap. I have to know who's going to pay. I don't have to know how I will get my money before I start to train you. I try to treat you.
And with the health insurance scheme, it will be accessible to all of those that are
currently accessible. We have over 325,000 people who have registered for that scheme today.
325,000?
Yes.
That's massive.
Our target this year was to hit 150,000.
Wow.
We still get the scheme to about 500,000 this year, and in 2 years' time to about 1 million. So with that, can you imagine if you had 1 million people contributing 500, 600, 500 naira a day, or 12,000, 12 to 18,000 naira a year? How much money that would have? And we have a young population, so not everybody will be coming to hospital quickly. So the dual health insurance arrangement is very viable. And I want to request our adult people to key in. Okay, especially if you have old parents who are not healthy, they can be supported. They can get service. And then the other thing we did today, in fact, we had a Security Council meeting, and I didn't know, and it was one of the things the controller was thanking me about. He said, apart from what you did for us in COVID, do you know every inmate in the prisons today in Edo has health insurance?
Every inmate?
Yes.
Wow. Under this administrator.
But we get problem. We solve our problem every day.
Now these reforms now bring all this jealousy come now. Why they say they want to arrest you next week? So
that's jealousy. That's wickedness. When you see progress, when you at least you will see progress, you'll be happy. You say,
yes.
They don't see progress, and because of their inherently wickedness, they say, why should they be in? Why they forget? They will fail to focus on what we are solving, and we are caring for our people, right? Pensioners now, they don't pay anything. Every month we government pays for them. So as you pensioner, you just carry anything they do, you quickly just carry yourself, go meet your primary health care and then check you. Because it's already paid for.
All the pensioners they do.
If your pension for Edo, pay your insurance.
And I believe I do all this work. Oh, now, you see, they don't get into it, they want to talk. They don't feel close our mouth because they don't want us to. They don't want us to sing your praise. See,
Yes.
they want us. They want us to silence that part. Say no. Be believe my do all they want. I wasn't they want because what they wanted to sell out there is that Binima governor not the work, but your excellency, you pepper them with your good work. Now why would they see the talk to online? Will you just say eyes on the ball, eyes on the ball? I go call. Make governor come to interview. Make governor. They'll say no, our guy is working. No, eyes on the ball. Your excellency, you have done well.
Thank
Any
you.
drama where they pre come, people don't already know you have done well.
We will wait for them.
We will wait for them. Your excellency, primary health care clinics across the state.
So that education hub that day when we go, primary health care did that. School of Health Technology, primary health care did that. Yes.
Inside the education hub.
And one of these primary health care centers on they build, we connect fiber optic, they connected to them. You know why? Because you can do telemedicine and internet consultation. So doctor no need to go the hospitals in the rural location every day. From there, they can say, okay, no, so many appointments do we have? Okay, this person has come. Oh, yeah, the person will sit down across the table. Yeah, doctor they online, via Zoom or whatever application that they use. And say, okay, what is wrong with you? Nurse, don't check you, check your blood pressure, check your temperature, check this. And you just consult with you online. So you can now get doctors being able to manage their patients in the rural areas. That is what is so great about this primary healthcare center.
You know, what with the experience here, sometimes now, it may be, we'll just call our GP. GP is okay. They'll just send us go the next pharmacy. Okay, go to social pharmacy. As you reach your name, not the system, they'll give medicine, say where you go.
Mm-hmm.
So you know, the question here is primary healthcare clinics across the state, how equipped are they?
You see, what we need is standardized. So when you look this is not primary healthcare, from the roof to the buildings, everything is standardized. That's going because even before we set up any primary healthcare center, we do an analysis. Each primary healthcare center is supposed to serve a population cluster of between 50 and 100,000 people. So we know that they will be viable, but it's easier, cheaper to go to your local clinic than take taxi or transport all the way to Central Hospital. That could be discouraging. So the thing is that we went through a lot of work. The design, when you come in, what should you have? What should be the consultation rooms? Where should be the room where you just also offer services and teach the women, give them render services for prenatal and antenatal care. So and we'll have an idea of what it will cost. So we can't say, okay, we give you primary care center to construct, and you tell me it is 1 billion. I say, no, it's not my own. Because what we have done design, and design basically speaks to how many people we should have the holding capacity, how many people we can treat. 2, quality of people who are there. So we don't know how many people minimum must be in a primary healthcare center, and that we have trained them and we can regulate them. 3, we also need to make sure that there's regular power supply, 24/7 electricity. Because without electricity, how can you even function? So in every primary healthcare center, we have solar panels, solar cells to give electricity to the center. Because I went to one primary healthcare center many years ago before COVID, and they were delivering a baby with torchlights. And it was like the normal thing. So we have standard infrastructure. All of them must be fenced. There must be security. So it's a haven. When you get in there, then you are safe and you will get quality care.
Wow. You know, the emergency response. This one is from someone.
Okay. I just say now you know everything. Now you know everything like this. I say, where you know everything like this?
I prepare my own. I've got my own 6 questions here, but this one is from the comment. This one is from the comment section.
Let me just deal with the comment section. Let's deal with the people.
Okay, sir. Okay, sir. Please, guys, share this video. Drop your comment. We already have almost 2,000 comments. People are just commenting. They are excited. They are appreciating. They are, they can't wait. They can't wait for the re-inauguration, because the next week inauguration, I read the publication where we'll reach there, because before you come on, we must do like 5 minutes small politics for inside. We'll reach there. The emergency response system exists in Edo State. We see as in people they call, they say, before you call a local, the way they happen here, Your Excellency, how do they collaborate with hospitals? Where if they pick a patient, where they carry they go?
Okay, you see, like I said, everything is integrated. This emergency response, we for no fit do them without health insurance. Because, as we call them, an emergency. If something happened to you suddenly, you get a cardiac arrest, you want somebody to be with you within a certain time limit and move you to the point of care. So to do that, everybody in that chain has to be integrated or related. So the drivers, when they drive the ambulance, you have to train them. They have to be part of the system and committed and dedicated. Because sometimes the doctor will do that thing, driver need to go, and he needs to be trained to understand what to do. The second thing about this EMS is that it's community-based. Because you never know when you will be sick. And when you're sick, another time they carry you go General Hospital or UBT.
Yes.
You should be able to administer something to you there to keep you alive. And that's what happened.
Another question from a big fan. This one say, I just pray not to repeat some of the questions so you don't already. Say, what challenges did you face and how did you navigate them? Then you'll come Maria with, if you were to do something differently, what would you have been and why? What would it have been?